Hi friends, in this video of general examination today I will talk about blood pressure. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Coming to the blood pressure, this arterial blood pressure, it can be defined as lateral pressure exerted by a moving column of the blood on the walls of the arteries, and it is calculated as cardiac output multiplied by peripheral resistance. Systolic blood pressure is defined as maximum blood pressure in the arteries which is attainable during systole, and it is normal systolic blood pressure is 120 plus 20 mm of mercury. And diastolic blood pressure is defined as minimum blood pressure that is obtainable at the end of ventricular diastole, and the range is 60 to 90 mm of mercury. Pulse pressure denotes the difference between systolic blood pressure and diastolic blood pressure, and it is usually on an average 40 mm of mercury. Mean arterial pressure is diastolic blood pressure plus one third of the pulse pressure, and the normal value is 95 mm of mercury. Whenever we tie the blood pressure cuff to the arm of the patient or a person, we usually, when we deflate it, we usually hear the sounds. We call them as a cough sounds. And for systolic blood pressure, when this cough sound is heard at 120 mm of mercury, we call it as phase 1. A third, when it is at 110 mm of mercury, it is phase 2, a blowing noise. At 100 mm of mercury, phase 3, it is a softer thud, and at 90 mm of mercury, we get phase 4, a disappearing or blowing noise, or we call it as a muffling sound. And for diastolic blood pressure, which is 80 mm of mercury, the phase 5 is no cough sounds heard. So while we check the blood pressure, the time at which a first cough sound is heard, we label it as a systolic blood pressure, and the point where the cough sound disappears, we call it as a diastolic blood pressure. The various ACC or AHA guidelines for hypertension released in 2017 are: normal blood pressure is when the systolic blood pressure is less than 120 mm of mercury and diastolic is less than 80. And we label the elevated blood pressure when the systolic blood pressure is 120 to 129 and diastolic is less than 80. Stage 1 hypertension is when the blood pressure, systolic blood pressure is 130 to 139, or diastolic blood pressure. Here you are using the word or, either systolic or diastolic. The systolic blood pressure 130 to 139 and diastolic 80 to 89, we label it as a stage 1 hypertension. When the systolic blood pressure is more than 140 or equal to 140, or diastolic blood pressure is more than or equal to 90, we label it as a stage 2 hypertension. And hypertensive crisis is when the systolic blood pressure is more than 180 or diastolic blood pressure is more than 120 or equal to 120. And these guidelines are comparable with the JNC 7 guidelines also, where initially the systolic blood pressure of 140 to 159 or diastolic blood pressure of 90 to 99 was classified as a stage 1 under JNC 7, but now this comes under stage 2 hypertension. What are the steps which we should take while measuring the blood pressure? These are very important. We have to check whether the patient is comfortable or not, has he has taken anything else or not, are we using the BP cuff suitable to his size or not. So various key steps are: in the step 1, we have to properly prepare the patient. The patient should rest comfortably for at least 5 minutes prior to the measurements in seated position with their back supported. The patient's legs should be uncrossed with the feet flat on the floor. The patient should avoid caffeine, exercise, smoking for at least 30 minutes before the BP measurements. We should ensure that the patient has emptied his or her bladder. Neither the patient nor the examiner should talk before or during recording blood pressure. Remove all clothings covering the location of the cuff placement. Measure Measurement made while the patient is sitting or lying on the examination table do not fulfill these criteria. Step 2 is we should use proper technique for BP measurement. Use a BP measurement device that has been validated and ensure that the device has been calibrated periodically. The aim should be bare and the arm should be bare and should be supported at desk and kept at heart level. Position the middle of the cuff on the patient's upper arm at the level of the right atrium, that is the midpoint of the sternum. We should choose the correct cuff size such that the bladder encircles 80% of the arm, and note if a large or smaller than normal size cuff is used, the lower edge of the cuff should sit 3 cm above the elbow crease with the bladder centered over the brachial artery. Either the stethoscope, diaphragm or bell may be used for auscultatory readings. Coming to step 3, take the readings, proper measurements and treatment of elevated blood pressure and hypertension. At the first visit, record BP in both arms. Use the arm that gives the high reading for subsequent readings. Repeat blood pressure measurement should be taken 1 to 2 minutes apart, needed for diagnosis. Increase the pressure to 20 to 30 mm of mercury above the level at which the radial pulse is extinguished. Place the bell or diaphragm of the stethoscope over the brachial artery. Open the control valve so that the rate of deflation of the cuff is 2 mm of mercury per second, and listen to corticough sounds. Systolic blood pressure is the appearance of the first corticough sound, and the diastolic blood pressure is the point at which the sound disappears, that is phase 5 corticough. If corticough sound continues as the level approaches 0 mm of mercury, listen for when the sound becomes muffled to indicate that as a diastolic blood pressure. Step 4 is the properly document accurate blood pressure recordings. So record the BP to the closest 2 mm of mercury on the sphygmomanometer, as well as the arm used and position of the patient supine, sitting and standing. We have to mention that. Note the time of the most recent BP medication taken before measurements. Step 5 is average the reading. Use an average of more than or equal to 2 readings obtained on more than or equal to 2 occasions to estimate the individual's level of blood pressure. In the presence of atrial fibrillation, minimum of 3 blood pressure readings have to be estimated. Step 6 is provide BP reading to the patient. Whatever BP we have recorded, we should always inform the patient both systolic and diastolic blood pressure reading, both verbally and in writing. So this is the position how we take the blood pressure. The patient should sit upright with his back straight. The arm cuff should be placed on his arm at the same level of the heart. He should relax his hand. He should sit comfortably on the chair with his feet flat on the floor. And he has to follow all the previous precautions which I have already mentioned, that he should have emptied his bladder, should not have taken caffeine or smoking at least 1.5 hours before. Coming to ideal BP cuff size in adults. For smaller adults, the arm circumference of the cuff size is 20 to 26 centimeter, and 27 to 34 centimeter is used for adults. 35 to 44 centimeter is used for larger adults, and 45 to 52 centimeter is used for adult thigh. White coat hypertension, these are the few terms which we should remember. White coat hypertension is the patient have normal blood pressure at home or on ambulatory blood pressure monitoring, but he has elevated blood pressure when he comes to the doctor or in his clinic. Masked hypertension is elevated blood pressure at home or ambulatory blood pressure monitoring, but it is normal when he comes to attend the doctor or in the clinic. Pseudo hypertension is defined as a uh, cuff diastolic blood pressure more than equal to 15 mm of mercury higher than simultaneously measured intra-arterial blood pressure. A palpable, although pulseless radial artery while the BP cuff is inflated above the systolic pressure is a positive oscillar sign. Oscillar sign occurs due to Monkenberg's sclerosis of the artery. What is paradoxical hypertension? It is on starting the treatment with antihypertensive, the blood pressure rises instead of falling in the following conditions. For example, patients who are on ACE inhibitors or ARBs, patients who are on beta blockers when it is given for pheochromocytoma, and beta blockers in patients with diabetic autonomic neuropathy. This table gives us the view about definition of hypertension as per the ACC or AHA guidelines. Those are 17 ESC or ESH guideline 2018. In clinic, if the blood pressure is more than 130 by 80, it is hypertension. As per ESC and ESH guideline, if it is more than 140/90. The self-measured blood pressure, if it is more than 130 by 80, it is uh, hypertension as per ACC AHA guidelines, and when it is more than 135/85, then it is as per the ESC or ECH guideline 2018. If it is more than 135/85, it is called as a hypertension. Daytime ambulatory blood pressure more than 130 by 80 is hypertension as per ACC and AHA guidelines, and it is if it is more than 135 by 85, it is hypertension as per ESC or ESH guidelines. Nighttime ambulatory blood pressure, if it is more than 110 by 65, it is hypertension as per ACC or AHA guidelines, and if it is more than 120 by 70, it is hypertension as per ESC or ESH guideline. 24-hour ambulatory blood pressure, if it is more than 125 by 75, as per ACC or AHA guideline, it is hypertension, and when it is more than 130 by 80, then it is hypertension as per ESC or ESH guidelines. Paroxysmal hypertension is elevated blood pressure. It is seen in pheochromocytoma, labile hypertension, carcinoid, clonidine withdrawal, renovascular hypertension, seizure disorder, hypoglycemia, cheese reaction, anxiety, panic disorder, hyperthyroidism, coronary artery insufficiency, cluster or migraine headache, CNS lesions like stroke, tumor, hemorrhage, drugs like cocaine, LSD, amphetamine, baroreflex failure, and factitious hypertension. Hypotension is defined as when blood pressure is lower than 90 by 60, and causes of hypotension are younger adults and pregnancy, vasovagal syncope, situational syncope, primary amyloidosis, primary autonomic failure. In younger adult age group like patients with chronic liver disease, diabetic autoneuropathy, secondary amyloidosis, Addison disease, hypopituitarism, severe hypothyroidism, and in older adults, Parkinson disease, dysarrhythmias, micturition syncope, carotid sinus syndrome, vitamin B12 deficiency, and postprandial hypotension. In postprandial hypotension, blood pressure fall occurs within 1 to 2 hours after taking meal. Coming to postural hypotension or orthostatic hypotension, a drop in blood pressure due to change in body position when the person moves to more vertical position, that is from sitting to standing or from lying down to sitting or standing. Postural hypotension is diagnosed when within 2 to 5 minutes of quiet standing, after 5 minutes period of supine rest, one or both of the following if it is present. At least a 20 mm of mercury fall in systolic blood pressure, or at least 10 mm of fall in diastolic blood pressure. If any of the two criteria is met, then we define it as a postural hypotension. Many disorders they can cause orthostatic hypotension because of two major mechanisms, that is one is the autonomic failure and another is the severe volume depletions. Autonomic failure is seen in diabetic neuropathy, Parkinson disease, dementia with Lewy body, Drager syndrome in MSA, spinal cord transection, chronic kidney disease, amyloidosis, Guillain-Barré syndrome, paraneoplastic autonomic neuropathy, familial dysautonomia, primary autonomic failure, and in patients with volume depletion like acute or subacute volume depletion due to diuretics, hyperglycemia, hemorrhage, vomiting, chronic hypovolemia, a frequent feature of autonomic failure, exacerbates the orthostatic hypotension. A healthy lifestyle is the best prescription anyone can have. With this, I conclude my today's topic. In next video, I will come with the JBP. Thank you. Keep learning.